we can turn our attention to now public health. Having understood the concept of health, having understood the concept of disease, the different models, the different theories, we can now turn our attention to public health. What is this field all about? So in this session, by the end of these sessions, because there are going to be several, we'll be able to understand what public health is, the principles of public health, the roles of public health professionals, historical development of public health, and the concepts to do with disease prevention. Okay, so these objectives will be attained. We'll be able to achieve these objectives in the different recordings that we shall be having. So we start with public health. So what is public health? It is very hard to have a definition of public health without the following words. One, public health being a discipline, and that discipline, of course, involves science and art. Okay, and then the other thing that we will not miss in the definition of public health is populations and communities, or basically population. You cannot miss to have the word population there. Okay, so those are things that must be there. And then what professionals in this field actually do. That is promoting and protecting. So these also have to be, they will always be there. So here, we are saying that public health is a multidisciplinary science and art of promoting and protecting the health of communities and populations. It's a short definition, but very important. This part, it illustrates that public health is multidisciplinary, meaning that there are a number of different disciplines that constitute what we term as public health. Okay, you'll have social science, you have health sciences, you will have management, you will have a number of different disciplines being very important in the practice of public health. So, the word population, what does it mean in public health? Public health is concerned with protecting the health of population. So these people here, these groups of people or individuals who are living in a particular area, these are the ones we are terming as the population. Sometimes they may not be in the same geographical area, but may share a particular characteristic. Okay, so public health interventions usually target entire populations or specific populations. So this definition that we have had here is it's not the only definition of public health that we have. We have several definitions, and it is very hard that every definition that you come across, you will actually be satisfied with it. Like I said, the most important thing is to understand the key terminologies that resonate with public health professionals in defining what public health is. Okay, so it's more than just a network of participants or providers of public health services. It's a broad social enterprise. So we have a lot of actors, and some of these actors can be as old as, let us say, the church, the schools, and many things, media. These are things that conventionally you may not think about them playing an important role in health, but in a public health sense, these are important health promotion avenues. Okay, so the emphasis, or what makes public health basically unique, is the fact that it's about maximizing population health impact. The focus is usually on populations. So what population are you talking about? Whether it is the population defined by geographical location or population defined by individuals who have particular characteristics. And then public health involves research. So research generates knowledge, okay? This knowledge has to be extended. And it is on the basis of this that we say that actually public health is a science, okay? Because the generation of public health knowledge is through empirical methods, so basically research, okay? And it is through the use of this knowledge that comes from research that public health as a discipline actually advances. There are these P's, the P's of public health: protection of health, promotion, health promotion, and prevention of diseases. These are the core aspects of public health practice: prevention, promotion, and protection. Okay, and again, this statement that public health is not just a network of professionals is echoed here, that you have very many actors, very many sectors, and all these sectors have to work collaboratively. And if we come back to this definition lacks that element of who are the people doing the promotion and protection of the health of the communities and populations. Usually this is through community efforts, and this is what is basically being emphasized here. Okay, so you can already say that this definition still has its own limitations. So public health involves working with different people, and others are actually far away from the health sector. So that's why we say it applies what we call the interdisciplinary approach. And then it is prevention focused. It's not like clinical medicine where you have to deal with individuals that come to the health facility, you treat them, they go home. We focus on preventing these conditions from happening. The government plays an important role in public health. So public health is quite unique in that you have the government having a unique role in public health. And this is often related to the enactment of laws and policies or policy guidelines on public health matters. Public health keeps evolving, so it is not static, it keeps on changing. The public health of the 19th century is not the public health of the 20th or the 21st century. It's definitely different. You have new problems that are emerging, and these new problems are basically public health challenges that have to be addressed. And again, the whole issue again here is that you have collective action against avoidable health issues. Still, it goes back to this collective effort that you need to have different actors coming together to address health issues. Okay, so who are these actors? Definitely, I mentioned that the government is very important, especially in matters to do with law, policies, and resource allocation. But also, you'll have institutions, whether private or religious, or even communities, or even individuals, playing an important role. And this is basically what we are terming as shared responsibility. Okay, so when we talk about public health in general, what we often use as the word public health system. When we talk about the public health system, we're talking about the infrastructure, the governance, the services, the facilities, and the public. All the things have to be in place to protect the health of populations, to promote health, and also to prevent diseases. And therefore, this is not in vacuum. It has to be with an engaged audience, basically the public. You cannot practice public health without engaging the public. Okay, and so a responsive public is very important. So building collaborations, partnerships with the public is very important. So what makes public health different from medicine as a discipline? Medicine is individual focused. A patient comes, they tell you the history, you do the different investigations, you give them the treatment that they need, they go home, and that's the end of the story. Often, with public health, the story is not about individual patients. The story starts with the particular population. So we look at the health of populations and implement whether health promotion interventions, preventive interventions, and things like that. So the focus is on populations, not individual patients. And in between there, you will have preventive medicine and community medicine, which are acting as a bridge between medicine and public health. So the P's of public health: health promotion, protection of health, and then also prevention of diseases. Those are the core goals of public health, and you can see it here and here. And of course, you can add this. When you achieve health promotion, you achieve disease prevention, and the also protection of health, then you are likely to have good health outcomes or better health outcomes, or basically optimal health outcomes. And this can only be witnessed by having improved quality of life and improved life expectancy. Okay, so again, you have different disciplines coming together: epidemiology, biostatistics, social sciences, environmental health, political engagement. So basically, public health is multidisciplinary in nature. You need to have knowledge in all this. We have what we term as the basic sciences of public health. Epidemiology, biostatistics, environmental health, health promotion are some of them. But of course, we are also saying even behavioral sciences, social sciences, and being politically aware is also very important in public health. Okay? So again, these are the P's of public health. Prevention, where we talk about primary, tertiary, and secondary prevention method. And then you also have promotion of health. This is about, when you talk about promotion of health, we are encouraging and promoting healthy behaviors among populations. When you talk about protection of populations, it's about making sure that communities are protected or safeguarded through vaccinations and environmental regulations. And then we have health education, educating people about the risks, health risks, preventive measures, and health promotion. Ensuring that everyone has access to healthcare and resources for optimal health. And also public health is responsible for ensuring that you have the tools, the policies, and the resources to handle any health emergency. Monitoring the health of the population is very important, and this is done through surveillance. Development of policies, this is very important at the government level, but also at institutional level. Engaging with the populations, or basically communities, in decision making in matters related to health is very important, as well as ensuring that the environment is free of environmental risks. Again, ensuring that particular health issues are handled, maternal child health issues, chronic disease issues, global health threats, strengthening the health system, conducting research. All these are objectives of public health. There are very many careers in public health. I cannot finish them. But definitely, you can become an epidemiologist, health educator, policy analyst, environmental health, toxologist, or specialist, health manager. Many, very many careers in public health.